Okay, thank you, Hildegard. Good afternoon, everybody. So, yeah, I'm Martin Gregg, and as Hildegard said, I'm a public contributor with People in Health West of England. I'm involved with South Gloucestershire CCG. I'm also an associate with CVS South Gloucestershire, and kind of like Hildegard, like Debbie, and I think like everybody on the panel, I'm passionate about hearing the public voice. I'd like to pick up on kind of some of the things that Debbie said, particularly about integrating policies and practice, because I've always been passionate about hearing the public voice, but not always from a health perspective. A lot of my career has been based in economic regeneration and employment policy, and the two are so directly linked. So if you're unemployed, you're at really much greater risk of being ill. If you're ill or disabled, then you're much more likely to be unemployed. There's an absolutely inextricable link between the two. So speaking from my perspective, I've been very much involved in kind of working with members of the public to have their voice heard, both at a strategic level and at an operational level. So with People in Health West of England, I sit on the executive body. I influence senior clinicians and managers, academics, to try and impress upon them not only the need but also the benefits of hearing the voices of people. And we put labels on people, don't we? We think of patients, carers, but actually we're all people. We've all experienced the health services one way or another. At an operational level, the executive oversees 18 health intervention teams, which is a partnership between practitioners, academics, looking at, in a partnership way, in an integrated way, at many different aspects of health, whether it's dementia, it could be self-harm, it's a whole range. It's a very exciting programme to be involved with. The clinical commissioning group, I'm a lay member. I'm a member of the board of the CCG, and likewise, I try to influence health delivery at a strategic level, looking at our operational plan, our strategic plan, but also at the way services are commissioned. And we involve patients and the public and carers at all levels of the work of the CCG. So why should people be involved? I mean, it should be self-evident, I guess, but it's not. I think it's all important to recognise that people are experts in their condition. They've got direct experience of the clinical condition of their clinical conditions, both either as a patient or as a carer. They've got direct experience of service delivery. They know how things work or how they don't work. And increasingly, I think people, members of the public, are much more aware and have much improved access to information about their conditions. And of course they have a personal interest in going to the heart of their own particular condition, with access to the internet, with more networking, and people are much better informed, and therefore they are experts, I think. And so we call upon people to engage, and we call upon them to get involved in a working group to develop the PPI strategy. We call upon them to get involved in the dementia hit. We call upon people to look at the health needs of their particular neighbourhood. So there are incredible challenges for people who are already vulnerable, may already be managing their own health conditions. So, I think we need to really support people to allow them to engage effectively. They have time pressures, they have financial pressures, they sometimes, often, sceptical about whether they are really going to make a difference. So I'm very interested in the support that we can offer to people to encourage them to engage more effectively. I think some of the ways that we can support people are perhaps to provide a degree of training, to develop not only skills but also confidence. I was talking with Morgan just before we started, and we were talking about the financial challenges faced by people engaging, and it's really nitty-gritty, detailed problems. So it's not just whether or not people get paid for engaging, it's whether that payment is going to affect their benefits. Do they get paid in a cheque or into their bank account or in cash so that they can pay the bus fare to get home? And I think increasingly I'm interested in how we can support peer support, so that people involved in different programs and different activities can learn together about how to have an impact. So in conclusion, I think we really need support. There's a real benefit to involving patients and the public. Policymakers, clinicians, managers, academics should view patients and their carers and wider members of the public as partners and experts in their field. People have a legitimate and valuable perspective to influence the development of clinical interventions and service delivery for the better. But the corollary, I think, and I'll leave you with this thought, we talk a lot about support for patients and the public, and clearly that's crucial. I think we actually need support for the policymakers, the clinicians as well, because sometimes they don't get it. And I've worked with them directly where they've been really nervous about going to a public meeting because they fear, because they're worried they're going to get lambasted. So it's a two-way process. Definitely support for individuals and the public, but perhaps some support for the policymakers to enter into that dialogue. Thank you.